I'm Taylor. I'm going to be your student nurse today. I'm going to be performing a full physical assessment from head to toe. I'm going to start by washing my hands. Can I get your name and date of birth, please?
Sky Mumford, 06/01/1885.
Okay, so do you have any questions or concerns? All right, I'm going to start with your head, and I'm just going to make sure everything's normal cephalic, there's no asymmetry. And I'm going to look at your scalp and check for any lesions or scaling or infestation of lice, and everything looks good. I'm going to palpate your sinuses on your face. I'm going to start with your maxillary and go up to your frontal. And I'm just looking for inflammation or tenderness, so let me know if anything hurts. Okay, and now I'm going to look at your eyes and examine them for PERLA, which is pupils equal, round, reactive to light, and accommodation. So I'm going to use a pen light if that's okay with you. And just look straight for me. Okay. And your pupils are constricting like they should, and they're both round and equal, so that's good. And then I'm going to have you follow the pen for me with both eyes. Okay, and then just follow it in and out, and I'm going to check for accommodation. Okay, everything looks good. And then while I have the pen light out, I'm going to go ahead and look at your nose, and I'm just going to look and make sure that your mucous membranes are pink and moist, and that there's no scaling or dryness, and there's an absence of polyps, and make sure that your septum is midline. And then go ahead and flare your nostrils for me and make sure that they're symmetrical, and they are, so that's good. And I'm going to go down to your mouth and make sure that your lips are pink and moist, and that there's no paleness or dryness, which could be an indication of hydration. So open up your mouth for me, please. Okay, and I'm just going to be looking at your tonsils and uvula, soft palate, hard palate, making sure everything's intact with no swelling or redness. Making sure that your gingiva is pink and moist with no discoloration, and that your tongue is without any white film or anything like that, and that your teeth are straight and white, and they were. So that's good. So now I'm going to go out to your ears and just make sure that they're symmetric and that there's no scaling or tenderness. And I'm going to push on both of your tragus to make sure there's no tenderness there. And then look for discharge. And that's absent, so that's good. And now I'm going to go down to your throat, and I'm going to be examining your thyroid and trachea, and making sure they're midline and they don't go side to side, and that there's no tenderness or lumps. Okay, and so now I'm going to be inspecting your chest or your anterior thorax, and I'm going to start with the respiratory status of it. So I'm going to just look at the skin and make sure that it's even with the rest of your body, that there's no lesions or bumps or tenderness or tender spots. So let me know if you're feeling discomfort. And now just breathe normal for me. I'm going to check your respiratory status by making sure that both sides are symmetrically even and that you're not using any accessory muscles to breathe, which you're not, so that's good. And now I'm going to auscultate your lung fields, and auscultate just means listen and just make sure that they're clear and without fluid. So you're going to feel me going from side to side. Everything seems to be fine, so now I'm just going to auscultate your cardiac status. So I'm going to be listening to your heart and then your valves. And your heart is located on the left side between your second and fifth intercostal space. And then I'll do your valves from there. Okay, the heart is clear, firmer, which is good. So I'm going to start with your aortic valve, which is in the second intercostal space on the right side. Go over to the pulmonic valve, which is in the second intercostal space on the left side. Go down to Erb's point in the third intercostal space, right below pulmonic. Go down to tricuspid in the fourth. And then the apical impulse, which is the maximum point of impulse in the mitral in the fifth intercostal space. And while I'm assessing your apical impulse, I'm going to go ahead and your apical pulse, so I'm going to go ahead and take your pulse. So after a minute, your pulse was 70, which is good because the normal range is 60 to 100. And while I'm doing pulses, I'm going to do your carotid artery pulse in your neck, and I'm just going to be looking for a bruit, which could be an indication of a blockage. So I'm going to assess the pulse on both sides. And then I'm going to listen with the bell, my stethoscope, for a bruit. Just turn your head to the right a little bit, please. Okay, that sounds clear, so that's good. And now I'm just going to examine the posterior thorax, which is the back of your chest. So once again, I'm just checking the skin to make sure that there's no lesions or there's no bumps, and that's the same color as the rest of your body, and it is. And I'm going to auscultate all the lung fields back here. So I'm going to be going from side to side once again. Just keep breathing normal for me. And you're going to feel me go to the right side. There's an extra spot of the lung I need to listen to over here, and it's only on the right side, not the left, because of there's more stuff on the left side. Okay. So all the lung fields back there sound clear. There's no bronchi or crackles or anything like that, so that's good. That means there's no fluid or anything like that.
Okay.
So before I move on, do you perform at-home breast exams on yourself?
Sometimes.
Okay, well, do you know how, or do you?
Not really.
Okay, well, I'm going to go ahead and let you know some information about it. It's best to do it once a month, and usually the first of the month, because that's easy to remember, and that way you have it, the same time every month, and you know that you're doing it. So to start, you need to be naked in front of the mirror so you can get used to the way that you look and how your breasts normally are, and that way you can tell early on if there's any alterations of the breast, which could be bad.
Okay.
So first, just be in the mirror and bring your arms out or your shoulders out like this, and then just kind of bring them forward. And what you're doing is looking for any dimpling or dents or wrinkling of the boobs, and making sure that the texture isn't kind of like an orange peel type,
Okay.
Make sure that the texture is normal and like the rest of your breast. And so then once you're done with that, you're going to go ahead and start your breast exam. So if you're going to be doing the left breast, you need to raise the left hand. And so once you raise it, put it behind your head, and you're going to palpate or feel around with your right hand.
Okay.
So you're going to start in the armpit or the axillary region and just feel for those lymph nodes. You want to apply pressure, but not too much. Don't hurt yourself. And then you're going to start circular movements, circular motions counterclockwise around the outside of the breast, all the way around, still just doing the movements, all the way till you get to the very center of the areola, which is your nipple.
Okay.
And then once you get there, you're going to gently squeeze and look for discharge.
Okay.
And if at any time you think that anything is abnormal, or you do feel any lumps or bumps or it hurts, then you take note of that and tell your physician. And that's the same with discharge. If there's any kind of discharge that you're not familiar with, you need to take note.
Okay.
And so then once you do the other side, you do the same thing. You will raise the right hand for the right breast and then palpate with the left.
Okay.
And then after you're doing that, you can take a shower, and then once you're laying down, do it again. But this time, whenever you're palpating the left breast, put a pillow under that side. That way the breast is pushed forward and they're both even and out, and it gives it a little bit of just kind of like a push-up. So make sure you're doing that, and then contact your physician again if you have any concerns or questions.
Okay.
So now I'm going to go to your upper extremities, and I'm just going to be checking your skin for any irregularities or lesions, and I'm going to be assessing the moisture and the temperature, making sure it's not too hot or cold to the touch, you're not clammy, and you're not don't have diaphoresis. And then I'm going to check your skin turgor and make sure that it goes down immediately. If it stayed up, that could be a sign of dehydration, which you don't have, so that's good. And then I'm just going to look at your hands and look for the same thing, making sure that they're not blue or cold. And then I'm going to check, make sure you don't have clubbing of the fingernails, and then your capillary refill. So when I do this, it should be 3 seconds or less, and it is. If it was greater than 3 seconds, that could be an indication of a circulatory problem. So that's good that it's normal.
Okay.
And then I'm going to go ahead and do your pulses on your upper extremities. So your radial is going to be on your thumb side, and I'm going to do it on both hands so I can make sure that they're symmetrical. Okay, they are, and they're both 2+, which is normal. So that's good. And then I'm going to do your brachial, which is the bend of your elbow. And And once again, these are both symmetrical, 2+, so that's good as well. Okay, and then the last thing I'm going to do with the upper extremities is your range of motion and strength. So I'm going to hold my hands out, and I need you to press against them as hard as you can.
Okay.
Okay? And then I'm going to do your range of motion. So let me know anytime if it's hard or if it's, painful or anything like that.
Sure.
So abduction is out, away from the body. Adduction is inwards, towards the body. And then flexion. And extension. Okay, and there was no tenderness or discomfort. All right, I'm going to do the same thing on this side then. Okay, the next thing I'm going to do is your abdomen, so if you'd please lay down for me if that's all right with you. And for the abdomen, I'm going to go ahead and auscultate before I palpate and stuff because we don't want any irregular vowel sounds to be brought up from the palpation, so I'm going to listen before then. And so the first thing I'm going to do is just kind of look at it, make sure it is contour and symmetric, and that there's no obvious bumps or anything like that. So I'm going to divide it into four quadrants, kind of just a visual. And this is going to be your upper right, your lower right, your upper left, and your lower left. And I'm going to listen in all four of those for vowel sounds. There should be one in each. Okay, I did hear a vowel sound in all four, and it wasn't hypertensive or hypotensive or anything like that. They sounded normal, so that's good. And now I'm just going to palpate. So let me know if you felt any tenderness, and I'm going to be palpating for any bumps or swelling or anything like that in each quadrant once again. Okay. I didn't feel any bumps or anything, and everything felt symmetric and even, and so that's good. And now I'm going to start with your lower extremities. I'm going to do the same thing I did with your arms, just looking at the skin for any skin integrity or noticeable bumps, or if you feel any pain, then let me know. And just checking the coloration, make sure it's the same as the rest of your body, that there's not any signs of circulatory problems as like cyanosis or anything like that. And there's not. So I'm going to check your capillary refill on your toe, just like I did with your finger. It should be 3 seconds or less, and it is. And I'm going to look at the pulses. Your dorsalis pedis is superior to your big toe, and I'm going to check that on both sides and make sure it's 2+ and symmetric. And then your posterior tibial is on the inside of your ankle bone, right under it. And then your popliteal, which is behind your knee. So you're gonna feel me under here. And they're both 2+ and symmetric as well, so that's good. So the last thing I'm going to do is your range of motion on your legs. The same thing I do with your arms pretty much. So I'm going to ask you to bend your knee and bring it inwards towards you for flexion, and then bringing it back out as extension. And then abduction is away from your body, and adduction. And then push on my hand with, okay? And then I'm just going to do the same range of motion exercise over here. So inwards. Okay. I am done with your physical assessment. I can help you up. I didn't find any abnormal findings, nothing that needs immediate attention. So everything checked out, and if you have any questions or concerns or anything like that, just let me know. So you're able to get dressed and put your shoes on now. Do you need any assistance with that?
No.
Okay, so here's your call light.
Thank you.
I'm just going to document this and wash my hands, and then I'll be on my way out.
Okay.
All right, thank you.